In today's Your Healthy Family, as part of Men's Health Awareness Month, last week we covered the basics of the prostate. In general, prostate health has really been kind of a taboo topic for men. But recently, screening guidelines for prostate cancer have become less hands-on. And it is such a treatable form of cancer if caught early.
Guys aren't very good about talking about things below the waist, and that's just a historic problem. I do think it's getting better, just as a generational thing. We do see with younger generations talking about health problems isn't such a taboo topic. A couple of generations ago, they never talked about their health problems. Personally, I tend to have more of a lighthearted personality when discussing these symptoms because all guys come in nervous. So the last thing you want to do is, make them feel even more concerned about what's going on. You just approach it with a lighthearted, kind of comedic approach. Let them know it's totally normal and it's common, and here's how we go about taking care of it. Don't worry about it. It just opens up the floodgates in terms of talking about it.
The recent changes to screening guidelines we told you about last week to a more hands or fingers off approach to prostate cancer screening will also hopefully encourage more men to get checked and be aware of their prostate health.
I think the safest way for guys to proceed is to have a PSA, which is a simple blood test that you can do once a year, just to establish a baseline, especially if there's a family history. Those are the guys that we really want to get on your radar earlier than later. That way, in the future, if anything changes with the PSA and it starts to show a pattern that's increasing consistent with cancer, then you're on top of it right away. The best study that we have looking at prostate cancer screening comes out of Europe. And it involved, I think, at least 8 different countries. It had over 180,000 men. So it was a very wide, very large study. And for their study, they only checked a PSA once every 2 years, and they only performed a digital rectal exam every 4 years. And they did show a benefit to screening. So the digital rectal exam typically does not have to be done on a routine basis. Back in the pre-1980s, when we did not have PSA and the old finger exam was all we had, a third of those gentlemen that we took to the operating room for surgery already had metastatic disease. So personally, my opinion is that the rectal exam was a little bit too late of a screening test. The vast majority of guys who get diagnosed based on elevated PSA have a normal rectal exam.
The urinary symptoms of BPH and prostatitis we covered in our last story are not usually signs of prostate cancer, but Dr. Bong says should still be checked out and treated.
Vast majority of the time, prostate cancer does not cause urinary symptoms. And so when we're seeing patients who purely are coming in for urinary symptoms or even blood in the urine, that tends to not be cancerous. It's usually benign reasons that are doing that. However, we do see patients constantly referred to us for an elevated PSA. Again, the screening test that can be done on an annual basis. We have normal age-related parameters for PSA. But even if patients fall out of those parameters, as long as that stays stable, you can watch that for a long time. We're really nowadays looking for the upward trend of PSA. So it's more of the PSA issues that tend to lead to the diagnosis of cancer as opposed to urinary symptoms.
If you've got a loved one or friend you know has been ignoring their prostate health, trying to talk to them about it directly might not be the best approach. Instead, think about encouraging them to have that conversation with a doctor.
If guys really want to start talking, talk to the doctor. It's easier to talk to a doctor about these type of issues, these types of symptoms. And then as you have that conversation over a period of time, it's easier to talk to your friends and your wife or your sons. Typically, in my gentleman with prostate cancer or even severe BPH, I always ask, do you have any sons? You'll want to talk to them about this. It does run in families.
And to find a link of how to support our No Shave November fundraising efforts here at News 5 to support the American Cancer Society this month, head to the online version of this story at yourhealthyfamily.com. For Your Healthy Family, I'm Ira Cronin.